Are you a nursing student about to start your career in nursing industry? If you are, this presentation is to help you build up your own resilience. It will also help you maintain a healthy work environment and optimum patient safety with the efficient use of your leadership skill. My name is Asma Islam. I'm a third year nursing student. I have collected data, evidence-based practices regarding nurse burnout to create this presentation. At first, I'm going to talk about the overview of the presentation, which includes background of nurse burnout, leadership practice to avoid burnout, research and policies to avoid burnout, importance of the use of proper communication media, and supportive elements in leadership. Now giving you a brief background of the topic burnout. Burnout is a syndrome or phenomena present globally in helping professions such as nursing and medicine. It is the deterioration of mental or physical energy level due to long-term unreleased workplace stress. It can be characterized by physical illness, loss of concern for other people, or lack of respect towards patients and other care team members. So, why burnout is a problem? Burnout is a problem because it increases the number of staff turnover, which leads to nursing shortage. And nursing shortage means inadequate staffing, ultimate job dissatisfaction. These all factors together decreases the quality of patient care and patient safety. What causes burnout? The concept of burnout is the syndrome of emotional exhaustion, depersonalization, and depleted self-accomplishment. As per Maslow's burnout inventory, those three factors overlap and causes burnout. What are the existing policies and procedures to avoid burnout? There are some existing policies and procedures to avoid burnout, such as occupational health and safety policy, employee assistance program, staff counseling, NSW Nurses Association released booklet, which is called Stress Management for Nurses, Maslow's Burnout Inventory. Maslow's Burnout Inventory is mainly for the researchers to determine whether the subject of the research has burnout syndrome or not. So now I'm going to talk about some contemporary nursing practices and in relation to burnout syndrome. Nurses contemporarily work in rotating shifts, long working hours, they do overtimes, work under time pressure, they care for sick and unwell patient regularly, sometimes work in short of staff situation, short of resources situation. They have a responsibility of delivering high standard of care over lengthy period of time. They need to maintain a diversified role, frequent adaptation to organizational changes in regards to policies and procedures. All these factors can individually or accumulatively contribute nurses to get burnout. So what is the significance of nurse burnout? In average business, staff turnover is 2 to 4%, but in nursing and midwifery, staff turnover is 3 to 6%. By 2025, there will be 85,357 nurses shortfall. Nursing and midwifery is the most trusted profession and they have high level of accountability to the public. Here is a projection what it will be like in terms of nurses shortfall by 2025 and 2030. This data was collected from Health Workforce Australia 2014. So, what are the leadership skills in solving nurse burnout? An effective leadership skill can resolve and minimize the level of stress nurses receiving from workplace. The quality of effective leadership would begin from effective communication to the employee and multidisciplinary teams. Respect to the employee, generous with resources, trustworthy team environment, chill out time, empathy, polite and admissive behavior for own mistake, non-blaming culture can improve the situation of workers' well-being and protect nurses from burning out from workplace stress. A new graduate nurse may not be able to have huge scope of leading co-workers as they are just the beginner of the career, but at least they can be a role model, staying positive, managing themselves personally and organizationally well balanced so others get inspired and follow their pathway of positivity. Research suggests that self-leadership as such, leading oneself, is a strong aspect to cope stress and avoid adverse burnout. Now I'm going to look back at the background again about burnout. The term burnout has been introduced by an American psychologist named Herbert Freudenberger at 1974. With the advancement of technology, nurses are introducing to new skills, adapting to new policies and procedures, high healthcare costs, limited resources. As a consequence, a significant number of nurses face burnout. So, what could be the responsibilities of a new graduate nurses to mitigate this problem? A new graduate nurse personally can maintain a balanced diet, regular exercise, rest, yoga, meditation, hobbies, and get organized. Organizationally, a new graduate nurse can use shift planner, prioritize tasks, schedule in breaks, carry backup food, focus on one task at a time, delegate tasks to others, ask for help, open up for feelings, admit not understanding patient condition or other issues, stay curious and know well about resources, and maintain an effective communication and respectful communication to peers. What are the legal and ethical boundaries? Ethically, nurses are required to deliver care for patients in a manner which exhibits beneficence, non-maleficence, justice, integrity, and patient in the center of care. And also, nurses are always legally bound to execute duty of care without any breach. So, what are the evidence suggesting to mitigate this burnout symptom? Research suggested that effective means of dealing with stress is to self-care, take support from organization. Now I'm going to talk about the elements I have used in this presentation for the audience. In this presentation, knowledge was delivered in appropriate nursing terms, PowerPoint visual slides for audience's understanding. Evidence and policies were included to gain audience's trust. Communication was maintained through verbal visuals such as pictures, animations, diagrams. Means a video was made to circulate in the YouTube channel so audiences can easily access the video and utilize all their senses to perceive the delivered knowledge. Thank you very much.